Hello, everyone, and welcome to Bayer for Health podcast. So, today we are discussing a very important yet often ignored health condition, deep vein thrombosis, commonly known as DVT. So, many people are unaware that prolonged immobilization, surgeries, fractures, or hospitalization can increase the risk of dangerous blood clots. And when DVT combines with pulmonary embolism, it becomes a serious condition called venous thromboembolism or VTE. So, to help us understand this topic in a simple and practical way, we are joined by renowned orthopedic expert Dr. Gaurav Singh Bhandari. Welcome, sir, and thank you for joining us today.
Thank you so much.
So, Dr. Gaurav, let's begin with the basics because many listeners may have heard the term DVT for the very first time. So, what exactly is deep vein thrombosis and why is it considered a serious condition?
So when we talk about deep vein thrombosis, it is basically the coagulating or the clotting of the deep vein system of the limbs. And why it is alarming is because the patients who develop deep vein thrombosis are likely to develop some further complications like what we call as venous thromboembolism or chronic deep vein insufficiency and all those things. And at times it becomes very fatal in such patients. So I have seen a lot of patients who have got deep vein thrombosis and we have planned for knee replacement surgery. And in such cases, we have to defer the surgery until and unless the patient becomes completely stable before the surgery.
Thank you, sir. I think that will really help our listeners understand the seriousness of the condition. So, as an orthopedic surgeon, you deal with patients undergoing surgeries, fractures, or prolonged bed rest. So, which patients are at higher risk of developing DVT?
So the thing is that patient who has got fractures, who are chronic smoker, chronic alcoholic, who has got some muscle injury, who have morbid obesity, and patients who have got a family history of venous thromboembolism, DVT, patients who are, especially in females who are on oral contraceptives, which have got estrogen, the patients who have got a sedentary lifestyle, not active lifestyle, no exercise routine in their normal lifestyle, and who has got long sedentary sitting uh, lifestyle. So such patients are prone for developing deep vein thrombosis.
So, sir, as you have mentioned about the patients who are on prolonged bed rest, so, sir, we often hear that these type of cancer patients or hospitalized patients are more prone to clot formation. So, why does this happen?
So cancer as such is a hypercoagulable state in which the blood becomes sticky, it becomes dense. So such patients, and also following chemotherapy, so the blood system completely changes. So like I said, the blood becomes in a gets into a hypercoagulable state. That means the the coagulation, the thickness, the viscosity of the blood increases. And such patients also have got a sedentary lifestyle are on or those patients are also on bed rest. So these two things combined together, leading to patient developing further VTs and all those things. So because of hypercoagulability of blood in cancer patients, along with all those drugs, makes such patient prone to develop DVT.
That's great insight, sir. So, one major challenge with DVT is that symptoms are often ignored. So, what are the early signs and symptoms patients should watch for? How can someone identify that it may be DVT and not just a normal leg pain or swelling?
So, first of all, important is always the history of the patient. The patient will give you a history of sedentary lifestyle. A patient who have more history of standing for long duration, those people also can develop DVT, such in traffic policemen. Then you have patients who are completely on bed, also can. So the symptoms are that the patient will give you a history of warmth of the limb. They will have pain in the calf, so there'll be swelling, there'll be redness, there'll be sore. soreness of the calf or the feet. And very important is, so sometimes patient develop with comes to our OPD and with bluish discoloration of the legs and hand. So such patient we always suspect DVT as our first probable diagnosis. So these are the symptoms. So the signs will be the patient will complain of pain, kind of stretching pain, or a like you have stabbing kind of pain in the calf. The patient even moving small movements and toes, also movement of the toes, also can cause increased pain in the calf and the legs. Sometimes the patient also develop a radicular pain. Sometimes the patient will see, oh, I've got sciatica, but it is something which is developing deep inside the body into the venous system, and such patient also can have uh, show signs of DVT upon examination. So sometimes you will have patients like I said, that they will have symptoms of sciatica. Probably they will be treated as sciatica pain. But when you do their diagnostic tools, test, and all those things, they they're shown to have developed DVT. So as a clinician, you should be well aware whether this patient, based on the history and examination, that this is a chronic venous insufficiency pain or it's due to a neurological symptoms or neurological pain.
So, but if in case if DVT is ignored or remains undiagnosed, so what complications can occur?
So you have complications. There are three things which are very common. So you have a clot, right? So that clot can remain in one place. Sometimes a embolus or a small clot piece can come out and get into your lungs, which we call as venous thromboembolism. That's a very fatal condition. The patient might come up to your emergency in ER department with a kind of shortness of breath and symptoms of cardiac arrest and all those things. That's number one. Number two is chronic venous insufficiency. The patient, because of the venous system which is affected in the body, in the legs, what happens in such patients is that due to this clot, the venous walls get eroded and they develop uh, continuous and persistent swelling of the limbs, leading to bluish discoloration of their fingers and hands and toes. Those are two things which we always keep a check on such patients.
Thank you, sir, for sharing your insight. So, sir, talking about diagnosis, so how do doctors confirm the diagnosis of DVT? Are there any specific tests or scans commonly used?
So what we do is, first of all, history is important. Then we do a Doppler study, in which it is a non-invasive tool. So you just basically normally whenever you have a vein, you press it, you will not see a vein. So it's a non-invasive tool. When an ultrasound probe press on the vein and it gets collapsed, that means the venous system is patent. And sometimes it doesn't get compressed. You don't see the venous system doesn't get compressed. That means it is not patent. So such tools are very helpful in diagnosing deep vein thrombosis. Number one. Then you have blood levels, which is called D dimer. It is highly sensitive, but not specific for DVT to rule out DVT. Having said that, patients who have got higher D dimer uh, does not mean they have a DVT. It could be due to other issues also. So D dimer, when I talk about D dimer, it is basically a protein. So when the blood breaks down, so it releases proteins, and D dimer is one of the component of that. So whenever a patient has got high D dimer, we always think of a DVT as a probable di- uh, diagnosis.
So, sir, once DVT is diagnosed, so the next concern for the patient is treatment. So, what treatment options are currently available for DVT management?
So we have lifestyle changes, first of all. We never jump onto a surgical part or all those things. First of all, after taking the history, we need to find out what is the cause of DVT in such patients. So, like I said, in cancer patients, you have hypercoagulability state, obesity, smoking, and all those things. So when we talk about the lifestyle part, we have to ask the patient to stop smoking and alcohol intake, keep yourself properly hydrated. You need to wear some stockinets, tight elastocompressive garments. Uh, to live a sedentary lifestyle have and achieve a healthy lifestyle in which at least you exercise or walk. Limb elevation is another part. So this is the lifestyle modification part. When I talk about the medical part, So you have a lot of medications right now to prevent DVT. And second thing is, even if the DVT has happened, in such patients, you have to prolong the medical part treatment to basically help not to DVT get prolonged. So when we talk about the medicine part, so you have blood thinners and anticoagulants you have, which helps in basically preventing DVT. For example, like when we do a joint replacement surgery and all, so we give them a prolonged anticoagulant blood thinner therapy, so as the blood doesn't get clot in the legs, because after the surgery, the patient to get back to their normal routine, it takes time. And in such state, we always it is always advisable to start the patients on blood, some kind of blood thinner, so as to prevent any kind of hypercoagulable state, so as to prevent DVT and further VTEs. So you have, I've mentioned about the blood thinners and anticoagulants. Then you have surgical part also, in which you can use in high risk patient, in which you can use IVC filters or thrombectomies. So all those things are there. But as a surgeon, as a joint replacement surgeon, we give a prolonged blood thinner therapies in patients till they get back to their normal life.
So, sir, if I talk about the treatment duration, so typically how long does treatment continue for the most patients?
So it depends on what condition. Like for us in joint replacement, we give about 3 to 6 weeks of anticoagulant therapy till the patient becomes active in their life and do their normal routine activities like they were doing before the surgery. Uh, so 3 to 6 weeks is advisable. In patients who have already developed DVT, so they have a prolonged therapy for about 6 months or so. And in patients who have got family history, and in such cases, you have to even prolong for years.
So, sir, what precautions or lifestyle modifications should a DVT patient follow during recovery?
So active lifestyle, decrease of weight, cessation of smoking and alcohol. Follow your clinicians. Whatever medication they are putting you on, you have to start those. Take them seriously. You cannot actually buy them and keep it in the drawer and you don't take your medications. And always talk to your clinician about your get your blood parameters checked every 6 months, even if for female who are taking oral contraceptives and all. So you have to be very careful, because oral contraceptive which have got estrogen level, they tend to bring your body into hypercoagulable state, and they tend can develop. And these people are highly prone to develop DVT and all. So whatever you take, always follow your clinician's guidelines before taking any medication. Keep a healthy lifestyle. Keep your weight in optimum range, and a proper hydration is very important also. Yeah.
Thank you so much, sir, for sharing your experience. So, sir, basically, in today's lifestyle, where prolonged sitting, travel, and sedentary routines are very common, so what preventive measures would you recommend to reduce the risk of DVT?
Active lifestyle, very important. Active lifestyle. You need to be very active. The patient, if you have seen patients who are cancer patients, for example, they are on bed for long. They're not moving until and unless their muscle, their joints move. The blood will not even flow in the system. So the legs, the blood gets clotted and gets acclimated in the dependent part of the body. So in such patients, we always tend to make them at least out of the bed. Our first aim is to bring the patient out of the bed so that they start moving. Once they start moving, they tend to get out of that. At least that risk factor is decreased. That's number one. Um, Patients, we always advise them elasto-compressive stockings. So these compressive garments, they do not let the blood clot into the deep vein system. So because when a patient is lying down on bed for a long time, these all parts of the body becomes dependent. So these compression garments tend to at least close those walls so that the blood doesn't get accumulated into deep vein system and it is actually pushed back into the main system so that the blood keeps circulating and doesn't get clot. So limb elevation, compressive garments, okay, activity levels. At least if the patient is not moving, also at least some kind of physiotherapy would help in such patients so that their joints and their muscles are moved not actively but at least passively, so that bed doesn't get the blood doesn't get clot. Or such patients also we advise some mechanical devices at home so that at least even if they are not moving, there's mechanical devices compressing the deep system so that the blood is being pushed into the main venous system of the body. So there are a lot of things which you can talk to your clinicians and discuss how to prevent, and these are the basic crux I'm telling you right now.
So, Dr. Gaurav, this has been truly a very insightful discussion. So, before we conclude, what final message would you like to give our listeners regarding DVT awareness and prevention?
So DVT is something you need to be very careful. You cannot take this thing lightly. People who have got a long sitting jobs or long standing jobs, okay, they tend to develop DVT. They are very high risk candidates to develop DVT, and also definitely on patients who are lying down. So any single stationary movement or stationary position of your body, whether you're sitting for a long time, you're standing at one place for a long time, or you're lying down for a long time. These people are very high risk candidates to develop DVT. Not in one single month or two. It is prolonged. You have such lifestyle for years. Then you have family history, and then you have oral contraceptive people, females taking oral contraceptive, cancer patients, people who are not well hydrated. So these things you have to be very aware. Uh, that you have to find out whether you are a candidate for developing DVT or not. So precaution is just, I would say, first thing is activity level. Even if you're sitting for office goers who are sitting in the office for long 6 hours, 8 hour shift, I always advise them at least put an alarm in your phone or smartwatch. After every 45 minutes, you at least you need to get up from your chair, go take a walk for a minute, drink a sip, have a sip of water, and come back and sit down. This way, your muscle will never get fatigue. You will never develop DVT. Your muscles and joint will be always active. So these small bouts of walking also will give stimulus to your brain and increase your dopamine level. Your stress level will also come down. So important is to move your body after every 45 minutes. Do not stand and sit or lie down for anywhere for more than 45 minutes. Make a move after every 45 minutes. That's very important part. And hydration again is very important. And do not take any medications until unless advised by a clinicians. For example, patients who are taking some, I don't want to name the name, uh, they are blood thinners, like for example, warfarin. So you should not take anything which is high in vitamin K along with warfarin. So it's basically opposite to each other. So you have to be very aware and talk to your clinician that what all things you can, whenever you are advised on blood thinners, whatever you can eat, what you cannot eat, so all those things have to be uh, taken care of. Second things, when you have developed DVT and people are put on blood thinners, so and such patients are very prone for bleeding disorders also. So check and balance is very important in such patients. So always follow up with your doctors once you are started on blood thinners. That's my this thing.
Thank you so much, sir, for sharing your valuable insights with us today. And to all our listeners, stay active, stay aware, and never ignore symptoms like unexplained swelling or pain in the legs. Early diagnosis and timely treatment can save lives. Thank you for joining us on the Bayer for
All
Health
right.
podcast. Stay safe and take care.
Thank you so much.